Well, hi everybody. We meet again right here on My Doctor. So I hope you have been well and learning a lot from our show, because remember, we always try as much as possible and give you all the information you need to have so that you make informed health choices. And today's show is no different. So welcome to the show. My name is Winnie Lubembe, and as always, it's a pleasure to have you on board. So today the topic of discussion is all about postpartum depression. And I know for all the pregnant women, of course, they look forward to having or to holding their baby. And while a majority of them actually celebrate even after the birth of the baby, some women do not get to that part because they suffer from postpartum depression. So how does that come about? And first of all, what is it? How does that come about? And do all women experience postpartum depression? Well, we'll be answering all those questions plus many others. Remember, if you have any other question, feel free to interact with us. All the numbers will be displayed on your screen on how you can reach us, and of course we'll be more than glad to answer all your questions. So you want to stick around till the end of the show, because our guest is already here and ready for the show. So it's so good to see you and so good to meet you first time right here on My Doctor. Really appreciate your time. And before we get on with the discussion, why don't you say hi, tell the people who you are and what you do.
Thank you, Winnie, for the invite. My name is Pauline Machio. I'm at the hospital. I work at the MPSHA hospital as a clinical psychologist. And this month being the mental health month awareness, so there are various psychological conditions that we are bringing to the public to create awareness, see how we can prevent, because in healthcare, prevention is also one of the things that we do: prevention, curative, and management when the client comes to you at whichever stage. So thank you, and we hope to learn more from the conversation.
And we will learn more from the conversation. I like what you said, because I think for a very long time, and we were having this conversation before we came on air, of how right now it's important that people are focusing on mental health, because for a very long time we used to shelve it, because of so many reasons, among them stigma, and postpartum depression is actually one of them. Because when you hear stories of women, they'll tell you, yeah, I suffered from postpartum depression, but I could not tell anyone because people will say I am weak, or I'm not able to take care of myself and take care of my baby, because we want to be like super women, super moms, but at the end of the day we cannot do that. So on postpartum depression, can we just start with it? What exactly does that mean?
So in postpartum depression, this one has to occur after birth.
Okay.
And that's why we call it postpartum. Postpartum is after birth. And normally it occurs in many women, but mostly in young women, new mothers. 1 in 9 mothers, you'll get one has to have maybe postpartum depression. And this occurs after birth, and it goes on. It can go on even for about 1 year. So the diagnosis can start as early as 3 days after birth, but progressively after birth to 1 to 2 weeks, we call it like maternal blues, which we all experience. As you had said, childbirth comes with a lot of emotions: joy, fear, excitement. Sometimes it can be overwhelming, especially depending on how your pregnancy was. If it was a difficult pregnancy and even delivery, so sometimes it can start way back from antenatally, spilling to the postpartum. So it has a continuity kind of way from antenatal to postnatal. So when this occurs, then we are able to diagnose and get intervention as soon as possible, so that we don't go to the other severe form of a depression that could be clinical and even become now chronic in nature.
And we hope not to get there, because you just gave birth, you want to take care of your baby and your family at the same time. Can we just go back, paint a picture for us of what that looks like, because like you said, pregnancies are different, right? There's some people who will experience a smooth pregnancy, as in one of the groups, and some women were talking about like cravings and all those things, and someone was saying, cravings where, how? Because me, I've never experienced, the woman was saying, I've never experienced cravings and all those things. So goes to show how different pregnancies are for different people. And what she said is, people who've had like difficult pregnancies, chances are they might get postpartum depression. So just paint a picture for us. What does that look like postpartum depression? What does that look like?
So for postpartum depression, maybe I would start with the causes. Some of the causes, as I had said, are hormonal. You know, when you're pregnant, there's a lot of estrogen and progesterone that sustains the pregnancy. So once the hormonal changes start coming down, we experience those emotional changes in us as women. Just like when you're in your periods, it's as simple as that. Sometimes you have those irritability, emotions, mood swings. So it's just because of the hormonal changes. So in pregnancy, that also happens. Then of course, it can be overwhelming, especially maybe a first-time mother, or even if not a first-time mother, maybe you went through a CS, there's no caregiver to help you maybe take care of the baby, and also yourself, because of the scar, you are still healing, and it can affect you if there's nobody to help you take care of the baby. Then of course there's that history of depression, maybe previous history of depression, also family history of depression. So it can also occur because depression runs in family. It has a genetic predisposition. So sometimes there can be history of depression. So of course after delivery, of course some women feel they're also not attractive as they were. So it affects your esteem for some women because of the physiological changes that occur during pregnancy. You look at yourself in the mirror, you're still maybe swollen, you have that baby potty after delivery, feet are still swollen, so sometimes you feel unattractive. So it can affect your esteem and also your confidence level. So you might go into kind of a low mood. Then we also have first-time mothers and who are maybe unplanned or unwanted pregnancy. So psychologically it can affect you that you are not ready for this pregnancy, and that will also depend on who is responsible, like the spouse. If the spouse is responsible, you can navigate through very well. If they're not supportive and ready to help you carry throughout this pregnancy, then you're bound to get postpartum depression even after delivery. We also have financial challenges. As you know, COVID, with the pandemic, many of our loved ones, or even our sisters and even our brothers, have lost jobs. And so the financial obligation of just taking care of a new member of the family could be also overwhelming. And even men get paternal postpartum depression.
Do they?
Yes, they do get.
Do you call it postpartum though?
Yes.
Oh, in school?
It is called paternal.
Oh, paternal.
Paternal
postpartum depression.
Yes. So equally the men can also be affected. Well. So it's not only for the mothers.
Yeah. Well, I would want to know more on the same, but anyway, let's just go on. First of all, finish with the women, and then we'll come back to the guys.
And then, of course, good social support. If you have poor social support from your loved ones, and of course your doctor, all through, that good support during the pregnancy, what to expect, and even the spouse getting involved, and even your family member just walking with you the journey from pregnancy to what to expect, it becomes lighter for you to even navigate through in case of some of these challenges. So that good social support in terms of information, in terms of material, and even now emotionally. If you lack that, then it can be overwhelming for you as a person. So some of those are the risk, and also what we call some of the causes of postpartum depression. Yes.
So and some of these things, I don't want to say can be avoided, but I mean some people cannot afford maybe having a caregiver, right, with them to help them, and especially after they've had, whether it's CS or just normal delivery, that support. Some people might not have that support, or others might have the support, but like you said, depression sometimes runs in the family, and if it does, then you're most likely predisposed to getting postpartum depression. So some of these things that cannot be avoided, right? What then, and especially if, for instance, the aspect of caregiver or the spouse is not supportive. Yes. So in such a case, I know we come from cultures where African culture is very supportive in nature. True.
Girls will always go to their mothers, I suppose. So if you're not able to have your caregiver or can't afford, I think you can go to
find
maybe your sister,
someone.
a sister's place, or an auntie's place, or one of the relatives that you bond well with, so that she can be able, or they can be able to give that support. And it has worked for many people.
Okay.
Or a mother-in-law, or your mother coming over. I've seen that happen. Because you're not going to pay them.
True.
You understand?
True.
So the family support is very important. You don't need to have a caregiver whom you have to pay. Even a relative or a good friend who can come over and put up with you for a few days as you navigate through this. And it has worked for many months. Yes.
And then for, like you said, for those people who experience like difficult pregnancy, some women say that immediately you deliver and you see your baby, you forget all those things. Right? I don't know how true that is, but I think it works for different people. But then again, you say if you had a difficult pregnancy, the chances are you might actually end up with postpartum depression. So the question might be why? Because you see, I mean, you have delivered, right? So is it a matter of like the hormones still all over the place that again predisposes you to postpartum depression? Or what exactly happens that then you have to carry that, let's say, after pregnancy again into postpartum?
So I said if those issues antenatally are tackled well, then chances of them spilling postnatally are low. But if they're not tackled well, then when you reach to that stage where now you're getting the baby, because these are unresolved issues before, then they can spill. But once you tackle these issues antenatally very well with your gynae, with your spouse, with even if you're a single parent, with the people whom you think need to support you. By the time, and the doctor's just taking you through the expectations that the pregnancies, and by the time you're reaching there, you've already overcome some of these fears and worries. So by the time you're reaching there, you're comfortable and you also understand what to expect. So the chances of you going to postpartum are less than somebody who has not dealt with.
And what are some of those issues? Because again, women will tell you, listen, pregnancies are difficult. You know, the mood swings, the cravings, the one time you're okay, the other time you just don't want to see this person, and all those things. You're tired, you're fatigued, you know. So what do these issues look like that again might put you at risk of developing postpartum? Is it more on maybe getting sick all the time, or what do they look like that might predispose you to postpartum depression? So
like after delivery, what you said, that there's that mixture of joy, excitement, anger, guilt. Let's say like unwanted pregnancy, we were saying maybe you're feeling guilty. What will be my parents say if you are a young girl? What will people think? You know the way the people perceive. So if these things are dealt with early enough and for you to understand, so that you are able to navigate through this, then it becomes easy. But the problem is, most of the time people don't want to come out, and sometimes it's not easily diagnosed. So once it's not easily diagnosed, because we are saying diagnosis is about 2 weeks, and even it goes along even up to 1 year. So how is your baby also? Is this baby okay? Are they falling sick? Are there children who need special needs? So that can also be overwhelming for you. So for us, the people and the caregivers and our loved ones, we really have to look out for some of these signs and symptoms of maybe depression. And then from there, now we can be able to now understand how these people need to be helped. So one of the things we need to look at is the signs and symptoms.
How do you know this person has
just
depression?
to know. So as we've said, depression is a mood disorder. Actually, that's how we define depression. It's a mood or affective disorder because it affects your mood. And most of the time you are on the low side, the depressive side. So this will affect how you think. It affects your cognitive functions. Sometimes you're not able to concentrate, you're not able to focus. And remember, you've had a new baby on board.
Fully dependent on you.
Who really depends on you, who needs your attention, who needs you to be there just to observe anything that is happening to them. So if you're depressed, it makes the child care and that bonding between you and the child difficult, because you can't be able to focus on what the baby needs to, the attention the baby needs. So, and of course after delivery again, you're supposed to be eating well. So sometimes you might have poor appetite, or you might overeat because of depression. It might affect your sleep pattern, where you might sleep excessively or lack sleep. You're always fatigued. You can't be able to take care of yourself. So there's that self-neglect of even your personal hygiene.
Yeah, and sometimes
And
it's like,
yes.
is it unconsciously or subconsciously, because you all the attention is going to the child that you forget to take care of your
Yes, so
of
you're
yourself.
not able to take care of yourself. How will you take care of the baby when you can't be able to take care of yourself?
Yeah.
So there's personal neglect in terms of your personal hygiene. And remember, after delivery, you need to be very clean because of the breast milk, you know, that just to make sure that chances of infection from you and the baby are minimized.
Yeah.
So when you're depressed, you're not able to even do some of these small things. Then you're also looking at yourself like a parent who is worthless. There's some sense of hopelessness and even helplessness, that you're not even able to take care of the baby, and feeling a sense of guilt and that kind of thing. So sometimes that happens, and also you may end up harming yourself and even harming the baby.
Okay.
We've seen incidences where a mother can easily even suffocate their baby because the baby is crying, they're becoming irritable, they're feeling the baby is bothering them. So they might do something that might cause harm to the baby, and even harm themselves. So, and of course, sometimes you're thinking about suicide and even what is the need of living. Because in depression, most of the time it enters into suicide, and we can prevent suicide prevention because suicide is one of the risk factors that occurs during depression. So we really have to take care of that, that a client doesn't reach to that point, because what they do, they can harm themselves and even harm the baby
as well.
So,
We've had, like, I mean, there's a time we were talking about, you know, I think a case of the same depression, severe depression, and someone was saying the mother, I think she was beating up the, like a newborn, she was beating up the baby, sometimes just throwing the baby around, and the other babies in the house she was also, you know, and she didn't understand why she was that mean. So I think maybe this was a case of postpartum depression as well. Does it have like different forms in terms of severity? Because like you said, others get to that point of harming the baby and harming themselves, others actually suffocating the baby or maybe killing the baby out of that. So can we talk about like the different either forms or severity of the same?
Sometimes we have the acute, we have maybe the acute, and then we go to mild, moderate, and severe, just like the way we categorize depression. Because we're talking about depression post-delivery. So in depression, we have a tool, a psychological tool that can be administered, which we call Vex Depression Index, where we can be able to now, there are questions, it can be self-monitored, or we can help the client fill in. Then you're able to categorize whether it's just the normal changes that happens after delivery to any normal mother, or it's mild form of depression, moderate, or even severe. Then from there now we have to see how we can help the client, because most of the time, if it is from moderate to severe, then we have to bring the psychiatric on board, because they have to help us give the antidepressants as we psychologists do the psychotherapy, just to identify what are the causes and how we can help them navigate through, of course including the family on board, and if it's a couple, the spouse on board.
What does that look like then in terms of, like, let's say acute or mild, or again, like you said, severe? What does that look like? Because like you said, I mean, after pregnancy, of course, there are those changes, you're not yourself anymore. There's a lot of things, and a lot of women tend to feel bad and again, depressed maybe. So someone might be like, so how do I know that maybe I have acute or maybe severe, you know, form of depression? What does that look like from one stage to the other, and what are the chances that you might actually move from acute or mild all the way to severe?
So the score that we talked about will be able to tell us that from maybe a score of 1 to 5, or you're having maybe just a score of 1 to 10, sorry, you're just having the mild, and then from anything below 10 is just the normal, let's say the normal mood changes that occur. Then from 10 to about maybe 20, and then we call it mild. Then from 20 to about 25, or 30 is about moderate. Then 30, anything above 30 is severe. So from there now we'll be able to, after the score now, the questionnaire that we ask, ranging from mood, ranging from how you feel, your thoughts, your feelings, and sometimes the behavior. Then from there we're able now to see whether it's mild, moderate to severe.
Or severe.
Yeah, yeah.
At what age do we see then the onset of, because like I said, age is also another factor as far as the risk, you know, to getting postpartum depression. So at what age is more at risk for a woman to fall into postpartum depression?
Of course, the young mothers, like the teenagers. Remember, like now the pandemic, we've had very many young teenage mothers just because of what has happened. They'd been out of school for quite a long time, and we've recorded very many high rates of teen pregnancies. So this is a child taking care of a child. So even in terms of their cognitive, their developmental stages, this is a teenager who is still going through the stages of teenagehood, and here you expect to take care of the mother. So the younger you are, sometimes it predisposes you, the higher chances. Unlike somebody who is mature and you are ready for a pregnancy, and you know what to do and you prepared yourself.
All right.
Yes.
Well, they say nobody prepares you for pregnancy.
But you are more enlightened, more even experienced. You even have a job. You can even take care of yourself in most cases. Or even if not, you have a business you're doing. And you know, unlike a child who is still relying on the parents. And their focus was meant to be education, and now you are a mother. Yes,
what about like the older women, like probably who, you know, get pregnant maybe later? Do they also have a chance of falling into postpartum depression? Because most people say this is like a high-risk pregnancy, right? So it has like a lot, as compared to someone who is in their, 20s, early 30s, the older women, it's a high-risk pregnancy in itself, so you go through like a lot of all those things. So do they also have like a higher chance of falling into postpartum
it depends.
depression?
Some of them will just have a smooth pregnancy, it depends. And even when we are looking at elderly mother, we're also looking at why is she getting pregnant at that time. You know, sometimes we are not in the position to judge and ask them, because some maybe they've been trying to get a baby. And you've had people who have been in marriages for even 10 plus years, and they're not able to get babies. Maybe I was married at 30 and I've been in the marriage for maybe, let's say, 10 years or even 15. So where does that place me? I was 30. I'm now 40 or even 45. Maybe that is the time maybe I've been able to get children because of maybe a medical condition or something that was happening or whatever reason. So sometimes they'll still go through the same antenatal care just because it's a high-risk baby. And most of the time they've been able to navigate through, because as you're saying, I'm sure this is maybe a mother who has been yearning maybe to get a child. Baby. You understand? So the moment they get the baby, I think they're in that position to really be careful, and also they're already prepared psychologically for this baby. So the risk might not be as high as a young mother.
Okay. And then the same case goes for first-time mothers as compared to a woman who has had
like any first time, even when you go to your first job,
it's scary.
Anything scary. For the first time, even your first job, there's that anxiety and that how do I behave, you know. So it's anything you're doing for the first time, there's always some sense of anxiety. Of course, some joy, you've gotten a job. But there's anxiety. Will I be able to deliver?
You're right.
So it cuts across.
Although we've also had some women who say, fine, my first pregnancy, smooth, easy, that's it. And then maybe like thereafter, you know, like the following pregnancies, some of them actually fall into postpartum depression. So I think
pregnancies
it's different.
Not the same.
It's
but of course, maybe the first time pregnancy, there's a lot of support. It also depends. Looking at the course, maybe the first pregnancy, all of us were excited, and then along the line, life events occur, and then some life events might just be overwhelming for us, and then you can easily get even in the second or third pregnancy.
Yes, you're right. Okay, so let's take a break, but of course when we come back there's still a lot that we need to talk about as far as then diagnosis, because like I said, it could be actually diagnosed between 3 days all the way to a year. What does that process look like, and is there treatment for the same, and is there a way that we can prevent postpartum depression? So we still have a lot to talk about as far as postpartum depression is concerned. But if you have any other question, feel free to interact with us. The numbers are there on your screen. Feel free to use them, and we're here to answer all your questions. But for now, let's take a short break to allow you to just take in all that we've talked about, and then we'll be right back with more. Stay with us. All right, welcome back. Glad you're still with us. This is My Doctor, and just in case you're tuning in right now, today our focus is on postpartum depression. It's very, very important for us to talk about this because, again, so many women are suffering in silence because of the same, because we do not want the society to judge us in one way or the other, thinking that we're not good mothers to our children. But some things, again, it's not that some women do not want to be good mothers. Sometimes it's just the changes that happen during pregnancy and even after delivery. So we just want to understand today what postpartum depression is all about, how it comes about, and what we can do, especially when it comes to support to the women who've just given birth. So it's a lot that we need to talk about, but for now we want to focus on diagnosis of the same. How can a woman who is going through postpartum depression, what does that process look like, treatment, and all those things? And of course, we have Pauline Machiu, who is a clinical psychologist right here at MP Hospital, helping us with all that information. So Pauline, diagnosis, because we've talked about, the different causes, symptoms, that we can pick here and there. But then again, I want to imagine you have to be really observant for you to pick some of those things, because sometimes people assume, it's just the normal changes that happen. But then again, this person could be going through postpartum depression and we do not know. So when it comes to then diagnosis, suppose we've noticed 1 or 2 or 3 things here and there, what does diagnosis look like?
So early screening, as we had said, early screening starts from way back, even antenatally, where we start from history taking, as I said. Is there a history of depression? Is there a history of previous depression from the client? So proper history taking from the onset also can guide us, so that we are looking at what we call preventive kind of, that this is a high risk mother who might experience postpartum depression. So that proper history taking from the first time you meet the mother, especially when they come for the antenatal care, is very important. Because it goes along, it's a record that we really have to be observant. Then of course now as the pregnancies grows, of course that journey, as we talked about, the gynae, the family members that would support will help us navigate through this journey very well. Then of course now post-delivery, now what happens now, either the mother and the child, and the issues that surround that is where we can be able now to look at the signs and symptoms that we talked about. The low mood, fatigue, loss of appetite or eating so much, lack of sleep or excessive sleep, feeling fatigue, feeling a sense of hopelessness, worthlessness, and suicidal thoughts and ideations, self-harm to you and your baby. You're not able to breastfeed, and remember breast milk is very important for the baby at this time. We call them the neonates. Baby who have just been born up to 30 days, they are called neonates. So breast milk, exclusive breast milk is what we advocate for. So if you're not able to breastfeed this baby, then we might go into complications that might affect this baby even in their future developmental stage as they grow. So in terms of maybe the complications from the mother side, if this postpartum is not treated on time, they might go into clinical depression and also chronic depression much later in life. Even the fathers, what we talked about, the paternal, postpartum depression, and then of course now the baby might have some challenges as they grow.
We'll talk about the challenges in just a moment, and thank you for reminding me the aspect of the paternal postpartum depression, because someone is like, but they did not carry the pregnancy, they're not the ones who spend all the time with the babies. How does that look like? And why would let's say the fathers develop paternal postpartum depression?
So the risks and the causes are more of the same like the mothers. One, young
you were not ready for that.
yes,
Okay.
young parents. They, of course, they're now struggling financially. Now there's also a new baby who has come in, a baby who has come in. They could also have poor relationship with the spouse.
Okay.
So that poor relationship with the spouse where you are alone. It's like you're walking alone. I'm supposed to be talking to you. I'm not able to talk to you. I'm supposed to be consulting you. I'm not able to consult you. So you feel a little stressed, and sometimes stress can be overwhelming and even spill to the other. And of course now, they might even start using alcohol and even maybe drugs just to deal with the stress, which is not good. So it also overwhelms for them, and then they develop that kind of mood disability.
What about the ones that run away from home because there's a new baby? And some say that no, it's because the woman, all the attention has gone to the baby, and now I'm left alone. I don't know what to do in the house. I feel I am not part of this family. Do they also have like some sort of paternal postpartum depression?
Presently, apparently, I've seen fathers. They're so much involved in their baby care,
which is good.
Yeah, which is very good.
That is really good. Yeah,
because one, the government also allowed them to have paternity leave for 2 weeks, which was not there before.
You're
so
right.
most of them this time they're also learning baby care, and they're very supportive.
Yeah.
I've seen most of them very supportive, and they're able to help the mothers even in diaper change.
Yes.
Just taking care of the baby as mom is resting. For those 2 weeks, they support, and that is the most crucial time. You know, 2 weeks, even before if it was a CS scar, you've not healed. So those 2 weeks are very important. So fathers, unless there's any other big issue, I know they are supportive. We can't just generalize and say.
No, absolutely not. No.
There are those who are also excited to be fathers, you understand? So that excitement also
somewhat helps.
With them,
Okay, all right. And then, so fine. So between 3 days, 2 weeks, all the way to a year, diagnosis can be made, and then of course you have to go to a hospital. But the big question is then, who do you go to see? You know, for you to get a diagnosis, because us as a people, let's say, who are supporting you, we might notice all those things, but don't know what to do at this point, because remember, like you said, there's a lot of changes that happen, especially mood swings. One time the mom is so involved and happy and all those things, the other time she does not want anything to do with the baby. So how do we handle that? And even before we talk about that, so fine, diagnosis, so who do we go to see?
Of course, when you're dealing with mother and child, the first contact is the gynae, the gynecologist who has been taking care of the mother. Sometimes they notice these changes. And of course the pediatrician, when now the baby is born and maybe they have to go for the baby care, they'll look at the baby and maybe they'll find there's some issue with growth. They're not growing to the normal,
as expected.
So maybe they'll be able to detect from there. Actually, it's either the pediatrician or the gynecologist who is the first contact both of the mother and child. So from there, they'll be able to assess and then refer to maybe a psychiatric doctor. And then from there, the psychiatric doctor will be able to make an evaluation. Once the psychiatric doctor is there to make an assessment and an evaluation, then they're able now to incorporate the psychologist. Because now we come in where we now are able to identify what are some of the causes and even how the client can be able to navigate through. We give the therapy, we do psychoeducation, either at a couple or family level, and addressing the root cause. What are the predisposing factors? What are the precipitating factors? Who are the protective people? How can the mother be helped to navigate through this journey? Who are the support system? So ours is more of that side, unlike the psychiatric doctors where they have to give now medication, because now we call it pharmacotherapy, where they have to give the medication because we don't prescribe medication for us. As we are more of talk and therapy, then they have more for diagnosis also, and also now the treatment. So it's a combined kind of, as of course they wean off and we address the issues, the mother is able to improve.
So at what point then does one need medication, and at what points, or are there instances where you can actually incorporate both therapy and medication as well?
Yeah. Of course, you look at the severity. Yeah, in some cases from moderate to about severe, you have to combine both the medication and therapy.
Okay.
So
what forms of medication are they given? Antidepressants mostly?
Yeah, they're given antidepressants. Yeah, mostly they're given antidepressants. Sometimes some of them also have anxiety, so they might be given more both antidepressant and just something also to calm them down and also improve their sleep, so that they're able to get enough sleep, and mood stabilizers.
Okay.
So that's what they're given, and then for us we tackle the issues, because the doctors will treat like more of the symptoms. For the psychologists, we are trying to address the root cause. What is causing this?
Exactly. Yeah.
Because you have to address the root cause.
Yeah.
And of course give the symptoms to address what has occurred. So we are more focused on just addressing what are the causes. And then in all types of medicine, even therapy, there's what we call preventive primary prevention. Of course, in primary prevention is now what we are trying to do. Yeah. Like now, public awareness. Yeah. So that people can understand and see how we can prevent. Of course, in secondary prevention is now where early detection, where you're able to do early screening and detections, and then you start treatment. And of course, tertiary prevention is a client has already come to you when they're already in that stage where the diagnosis has already been made. So we also do now the curative part of it.
Okay. So, because and especially the ones with a history of depression, some might ask, so for how long will they have to be on medication? And remember, this time maybe they're still breastfeeding, right? So what happens? Do they have to then maybe supplement with something else, or it does not affect breast milk?
No, there are depressants that are safe even during pregnancy.
Oh, okay.
Yeah, there are medications that are safer for pregnancy. Even diabetically safe for diabetic. You know, there's what you call gestational diabetes and even hypertension that comes during pregnancy. They are safer medications that have been proven and tested in the market that a pregnant mother can always get, even for the antidepressants. So we can't deny them treatment because of
pregnancy or even because of breast milk.
There are safer medications for that.
Yes, okay. Then for how long are they supposed to be on medication, or that is dependent on the severity?
On the client, how they are responding, the severity, but it's usually weaned off slowly, and then see until where you give a maintenance dose, and then see how we go about. So it's not just medication you just withdraw at once. It has to be systematic with the follow-up clinics, the doctor assessing and seeing how you are responding, so that it's tailor-made down, depending.
Okay. Yes. And then can it reoccur in terms of like other pregnancies that might follow? Because some people might be like, fine, okay, so I went through postpartum depression, now I'm more aware of it, and I know what to do to somewhat either prevent, or even if I am in that phase, I know what I can do. But what are the chances that if I had, let's say, postpartum depression in my first pregnancy or second or whatever, that in other pregnancies I might not experience the same, or I might experience the same?
You might experience the same depending on what is happening.
Okay.
The events at that pregnancy, the previous one might be different from the events of this pregnancy. But if all is taken care of well, then the chances of you getting, I think, are minimal. But that awareness that the previous pregnancy, this is what occurred, is what all of us should be aware of, that she is at risk. So what do we need to do? How do we handle the situation? But there's things sometimes beyond the client's control, and some life events that are beyond anybody. So we just help them navigate through, and they're able to even cope positively, because sometimes they understand the previous encounter, how it wasn't so easy for them. So they've also developed some resilience in how to cope with some of these things. So chances are they might get, but more manageable than somebody who has never gone through the same before.
Okay. All right. And then in terms of getting better, because again, people are different, right? There's some who respond very well to medication, they'll be fine, and others might not respond very well to medication. So even with treatments, what is the guarantee that this person will be okay, let's say in no time? Because we need them home, we need them to take care of the baby and all those things. So do you have that guarantee that yes, this person will be better in no time and go back to functioning very well?
Yeah, science evidence-based has shown that medication and therapy has worked for most clients.
Yeah.
So chances of them recovering and just being productive and going back even to the work are very high, because it has been proven that the combined therapy
works best.
Has worked best.
Yeah.
Yes, yes.
Do you give them time, like maybe after you start therapy and medication, prognosis, you know, you should be okay by, let's say, a month, 3 months, 1 year? Do we have like such timelines?
We take a client, it is individual.
Yes.
It's called patient-centered, as in we just take you through, but we know that with time, let's say after a couple of sessions, we expect to see some changes. After the doctor gives you some medication, we expect to see some changes.
Yeah.
So it's just a matter of assessment and reassessment as we go along, just to see how they're responding to treatment. Even for the medical doctors, the psychiatric, there's a medication they might be giving the patient and maybe it's not working for them.
Yeah.
So they might be able to change. Because even now in our therapy, maybe the approaches we're using, maybe it's not working. So it's just like reassessing and seeing what is working for this client and what work for this other one.
Yeah.
So it's just per patient. Yeah, we don't like have like one blanket approach for all of them.
Yes. Yeah, because again,
but the principles
like
for in terms of depression are more of the same, because we want to work on your thoughts, for you to have those positive thoughts, erase any irrational thinking, any distorted thoughts, and of course improve your mood. And then of course they now have good social support around you that helps.
Yeah, and talking of support, because remember, like we said, someone might be there but they're not there. They're there but they're not there, they're not supportive as much. So in terms of then support, what kind of support is needed, especially during this time, like let's say the late stages of pregnancy and even after delivery? What sort of support is needed that if this lacks, then of course the mother's life and even the baby is somewhat in danger because they don't know how to navigate this?
You see, after even the last weeks of pregnancy, for those who are mothers, who have been mothers, you understand, your body gets tired. That fatigue, and that's why even maternity leave was increased. Initially it used to be 1 month plus your annual leave, so you'd go for maybe 2 months. Now we have the maternity leave, which is 3 months plus now the annual leave, which is like 4, because they saw that that need for a mother to get enough rest, be able to relax enough. So during this period of antenatal, postnatal, it is very good for the mothers to relax and just learn baby care activities, understand what is happening. So that is enough period for you to navigate through. Sometimes having a house help whom you've trained, even when you go back. So it gives you a lot of time to really navigate and plan your things, so that even when you're going back to work, or even if you're going to school, depending, you already know how to, you've already taken care of some of these things. Because you can imagine going back to work after 1 month. You're still in pain, maybe you've not healed well. So I think that time frame of just the maternity leave has really helped for most mothers. Yes.
And especially the first time mothers, where like you said, it's different. Everything is just different. You don't know what to do, and all those things. Okay then. So we've also had instances of some mothers where the babies have to be taken away from them, right? Does this make the situation worse, or does this help in one way or the other? Because again, let's say the mother gets to a point where they want to harm the baby, and not because they want to harm the baby, it's just that things are happening and they don't understand what is going on, and then taking away the baby. Does that make the situation
It's just
worse?
like the safety of the baby.
Yeah.
You're not really taking the children away from the mother as such, just like that, not from the environment, but just a way for her to now to when you start now treatment and just seeing and giving her time to heal and that support. So it's just like the safety of the mother. Let's say like the gender-based violence victims. You're putting them in a residential safety place as you navigate through to see how safe the environment is and what happens thereafter. So for the mother and the child, you're not really like separating them, because that bonding is enough. This mother needs to breastfeed, so they have to breastfeed the baby with supervision. You understand? So you can't deny them that it's just like
time with the baby.
Yeah, with the baby. It's just
what
like,
if it's a case of like psychosis, right, where they have to be admitted at, let's say, a psychiatric center, because again it's like a severe form of postpartum depression, right? Plus, let's say, other mental health illnesses, right? So again, I'm just thinking, does that make this?
Of course, that one now they have to be separated. And they have to be separated, because now the place even where most of the psychiatric hospitals we have maybe may not be able to accommodate the mother and the child. So there's that safety for the sake of the baby, and also give mother time to heal, because in psychosis we are looking at what we call delusions and hallucinations. So when you have delusions, you are paranoid most of the time. You are suspicious, maybe they want to hurt you, they want to hurt your child. So you are behaving in a funny way. You have some funny, bizarre behavior. Hallucinations, you're looking at people are talking to you, giving you instructions, or hearing voices that are not there, and many other things. So it becomes like it's really something that has to be dealt with as the baby is away, of course, that one. The baby has to be safe. Because of that, those issues of hallucinations and delusions.
What if then postpartum depression is not treated completely, or it's not treated on time? What are some of the complications that are associated with the same, not getting treatment at all? Because some might think, well, this is just a phase, I will go through it and I'll come out better and stronger. But then it's not the case. Sometimes maybe it gets worse along the way. So either late diagnosis and treatment, or not receiving treatment at all.
And that's why we're creating awareness that early intervention, early screening, early intervention, the outcomes of even prognosis and outcomes are always good. So this creating awareness and for people to understand that is good. It's okay to be unwell and you seek treatment and have that insight that you need treatment. And even when the clients do not have insight, and that's why psychotherapy comes in, we help them understand that this is what is happening, and we psychoeducate them on some of the symptoms, what they need to do. So we are creating awareness at a personal level, and that also helps. So we believe that any medical condition, even if it's diabetes, if you don't treat early, of course, complications set in, like your eyesight, your kidneys and all that. So even for the mental illness, I think early diagnosis, early screening, the outcomes are always also
much
okay,
better.
because now we are avoiding what you're calling chronic now depression, that now may become lifelong, and you have to deal with it like for the rest of your life.
And for the baby as well, because I think we touched on this a little bit in terms of then if the baby experiences this, right, like the mother is not well at this point, will this affect them later, or even let's just say their growth? How will they be affected, and even later in life? So like mother who's having postpartum depression, they're not able to breastfeed their children. I remember the dad, this neonates are getting breast milk. So when they're getting formula, of course formula is there to supplement, but we advocate for breast milk because it has all the nutrients, natural. You don't need to buy, it's cheap. It's cheap also. You don't need to buy. So once the children are missing on this, then they get what we call stunted growth. And of course, in any form of stunted growth, it affects your cognitive functions, even your cognitive development, even in future, where you get these children could be slow learners. They could also have what we call learning disabilities, that they might fall short of an average student just because of what is happening. And of course also
emotionally, because they lacked that attachment.
Yeah,
because from the first attachment, we call the caregiver who teaches us attachment. So if you don't have that attachment from loved ones from a young stage, it might affect you even in future, even when you're having other relationships where you don't trust people, you don't, because you really didn't have that bond of trust, because a child trusts the mother for everything, safety, care, and all that. But since they lacked that, even in future, they are not sure whether this person is somebody to trust, or this is somebody I can. So it can affect even your future relationship, and of course behaviors as they grow, in terms of their sleeping patterns, their eating patterns, and of course what we call their eating patterns in future
as well.
Yeah, it can also be affected.
All right. So understanding this, that postpartum depression not only affects the mother but the baby and just the family in general, because like we always say, if one person is sick, we all get sick, you know, in a family. So in like 30 seconds, what would you like to say as your parting shot as far as just postpartum depression? And I would like you to just touch on stigma, because I think a lot of women face that, you know, that they're scared to even say, listen, I am not okay, I need help. What would you say in like 30 seconds?
Yeah, so I say mental illnesses in the past, there was a lot of stigma. Of course, there's also not enough personnel just to maybe to take care of the clients. But as we are developing, there's a lot of awareness, even at the community level, where the mental health and community health health workers are going even down to educate, to do early screening, and if they're not able to whatever to take care, they refer. So we have this referral system. So we should not be afraid. It's just like any other medical condition that can be managed, and the earlier the better. So early intervention, early detection, and early treatment helps in good outcomes. But that does not mean that even if you come when you're already having the condition, that we are going to judge you and ask you where you are. No. We will treat you and we will help you to recover and involve your family at large, and that will help.
Pauline, thank you very much for your time today. Appreciate it. Pauline Machiu, clinical psychologist right here at MPSHA, just giving us all the info we need to have as far as postpartum depression is concerned. So thank you, and please come back again for more. But for now, we have to say goodbye. My name is Winnie Lubembe. We'll see you on the next episode of My Doctor. But until then, as always, remember to stay safe and God bless. Goodbye for now.